My name is Brent Wilkerson, and I am a otolaryngologist, and I subspecialize in neurology, which is ear and lateral skull base surgery. I'm originally from Greenville, South Carolina, so it's good to be back home. I did my undergraduate schooling here at Bob Jones University. Then I went to University of South Carolina, first 2 years in Columbia, second 2 years here in Greenville. And then went to University of California, Davis in Sacramento, California. Did my fellowship at Michigan Ear Institute in Detroit, and now back home. Otolaryngology is the specialty of ear, nose, and throat surgery. I am specifically a neuro-otologist, so I operate on ear and lateral skull base conditions. So that includes hearing loss, the surgical medical management of hearing loss, balance disorders, and dizziness, and also conditions of the skull base, including benign and malignant tumors of the skull base. What steered me specifically to this part of medicine, ear and lateral skull base surgery, I grew up in a family of my father and my brother both had hearing loss, and my dad actually owned and operated a hearing aid business, and so I worked in that business for a while growing up. And then during medical school, decided that surgery was for me, and it was, I knew that I liked the ear and grew up with conditions of the ear and hearing loss. And it was a natural fit that I enjoyed surgery, enjoyed the anatomy of the head and neck, and specifically wanted to help those people who have hearing and balance disorders. Well, specifically in my patient population, the way I inspire health is to encourage my patient population that there may be more that they can do about their hearing and balance disorders than they may think. Hearing loss, for example, there may be surgical things that I can do that can improve their hearing loss or their tinnitus or ringing. And from a balance perspective, they sometimes are told that there's nothing else they can do. And balance and dizziness many times can be treated, maybe sometimes even resolved. And so inspiring those patients and educating my patients on those options is a priority. What I'll be doing outside of work, spending time with my family. So I have 5 kids, 4 boys and a little girl. And so we spend a lot of time outside on the lake, doing certain activities or school activities or sporting events. And outside of spending time with my family, which takes most of my time, which I enjoy, is I'm also an avid woodworker, and so I make pins on a lathe and other small projects that I enjoy doing and making things with my hand. And also enjoy running along the Swamp Rabbit Trail. To make an appointment with me, please ask your primary care provider to make a referral.